Hello everyone, welcome back to CaviTV. This is Dr. Juan, and today I'm going to be answering questions from North Arlington Pediatrics Nurses, doctors, and staff. Coming at you right up next.
Like I'm your Nintendo, break me like bricks through the wind.
On to the first question. What kind of dental emergencies can patients handle at home? In the case of an emergency, your first line of treatment should be going to your dentist. If you have a crown that falls off, you should try to keep the tooth as clean as possible and chew on the opposite side until you can get to your dentist. Now, there are reasons for and against gluing your crown back onto your mouth. I'll go into those in a future video. For tooth pain, you can try to take over-the-counter medications such as ibuprofen or acetaminophen. Something that I would suggest and advise against would be taking an aspirin and putting it next to your gum, because that can cause a chemical burn. They don't look or feel good afterwards. If you think you broke your jaw, do not go to the dentist, go straight to the ER. Next question. What if my tooth gets knocked out? Can you save it? If a baby tooth gets knocked out, you don't need to put it back in. If it's an adult tooth, you yourself can actually put it back in there. Rinse it under milk or water for 1 to 2 seconds and then put it back in your mouth. If you're too scared to do this, you can store it in a glass of milk or bring it with you by putting it underneath your tongue. Just please don't swallow the tooth. The most important thing when it comes to getting a tooth knocked out is to go to the dentist as soon as you can, ideally within 30 minutes. The longer you wait, the lower the chances that you have of your tooth surviving. If you get to your dentist within 30 minutes and they're able to put it back in there, chances of the tooth surviving are 90%. If you go there within 60 minutes, chances of the tooth surviving drop down to 50%. And then over that, chances are very slim of the tooth surviving. What causes bad breath? Bad breath, otherwise known as halitosis, is caused by germs or bacteria that release chemicals that are stinky. These germs are going to build up in your mouth if you're not good with brushing and flossing. You should also be using a tongue scraper or brushing your tongue afterwards. This is something that people don't realize. So something that you should be doing is brush your teeth. Once you're finished brushing all your teeth, go back in there and give your tongue a couple of scrapes with either a tongue scraper or a toothbrush. That'll help you out quite a bit. Now, bad breath can also be coming from other locations other than the mouth. It can be caused by respiratory infections, liver problems, stomach conditions. If you have any of those, go to your primary care provider so that they can further help you with that. The next question reads, what causes tooth sensitivity? Tooth sensitivity can be caused by two main things: over whitening your teeth or by having gum recession. In the case of over whitening your teeth, stop whitening your teeth immediately and start using sensitive toothpaste such as Sensodyne. In the case of gum recession, you're probably brushing your gums too hard or using a medium bristle toothbrush. You should always be using a soft or extra soft toothbrush no matter what. What is the fluoride treatment and what is it used for? Fluoride treatments are high concentration tooth vitamins. These are applied on your teeth by either brushing them on or having you bite on foam trays. I gotta say, fluoride treatments are phenomenal when it comes to the prevention of cavities and reduction of sensitivity. Although they're used on kids mostly, adults would benefit from them just as much. Are having many decays hereditary? Maybe, but you should probably be ditching all the sweet stuff and the sticky candy that you're eating and making sure that you're brushing twice a day and flossing every day. And make sure you see your dentist 2 times a year. What exactly is enamel? And does it grow back? Enamel is a hard outer part of your teeth. They're your pearly whites. It is not a living tissue and therefore it will not grow back. So take care of your teeth. How do you choose a right dentist? Simple. Come see me. But I guess you can also check out other places' Google reviews, Yelp reviews. Look at their hours and see if they work with your schedule. How fast can they see you? And do they take emergencies? How often do you need to go to the dentist? Every 6 months or 2 times a year, unless your dentist directs otherwise. What's being used now? Novocaine, Lidocaine, or Septocaine? What is the difference? Novocaine hasn't been used in the past 70 years. Nowadays, what's most commonly used in dental offices is Lidocaine with epinephrine. Here's a summary of the most common numbing agents used in dental offices. Feel free to pause the video for more information. How do you know if you're allergic to lidocaine? Lidocaine anesthetics are made up of three main things: lidocaine itself, epinephrine, otherwise known as adrenaline, and sulfites, which are preservatives. A true lidocaine allergy is rare. Some people are allergic to sulfites. You'll know this because you'll often also be allergic to maple syrup, dried fruits, grapes, red wine, and such. Talk to your dentist if you have any concerns before they administer these anesthetics. Can medications interfere with lidocaine or your health when getting it? When is it dangerous? Great question. If you have uncontrolled systemic conditions, and I'm talking extremes here, severe high blood pressure, hyperthyroidism, diabetes, any other cardiac conditions, lidocaine may not be indicated for you, but that is up to the discretion of the dentist, of course. I cannot stress this enough. When going to the dentist, tell your dentist what medications you're taking, what conditions you have. This is critical and it may save your life. A lot of medications do interfere with lidocaine, and we exercise caution whenever we administer it. If you are a cocaine user and you do not tell your dentist, you can die. Do not plan on using cocaine for at least 24 hours before your dental appointment. I can't believe I have to say this, but it is very important that you disclose this information to your dentist, especially if you're undergoing any major surgeries. Make sure you stick around for part 2 of this Q&A, which will be coming out very soon. A special thanks goes out to North Arlington Pediatrics. Thank you for the amazing questions and all your hard work that you're putting in during this pandemic.